The broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon, everyone. Thank you for your time today and for joining today's webinar. My name is David Watton, President and founder of IOIx Software. I will be conducting today's webinar. Just due to the volume of callers, I do have each of you on mute, so feel free to type in any questions that you may have, and then I will do my best to get to those questions either during the course or more likely towards the end of today's webinar. Today's webinar is designed for current users of our software. It does assume that you are familiar with the whole quote engine and the whole application process. I am going to go through the entire application process from beginning to end for both exchange and non-exchange. We've had so many things that have changed over the last 3 weeks. We've tried to send out email communications on that, but really the purpose of today's webinar is to kind of demonstrate that and to show you that the entire process of this service is working, from quoting to online application to the automatic building of client and policy records inside of Connected Agent and Agency Central. So kind of want to show that off a little bit. I also want to talk a little bit about our web broker connection, where we are at with all of this. We did a press release here, I think the end of last week or something like that, and talking a little bit about there's 30 different companies that have been authorized by CMS to facilitate enrollment through a web broker portal. Most of these companies, like the biggest one you've heard of, is like eHealth Insurance, Intuit, the tax people are getting into it. Most of these companies are actually using the web broker portal to facilitate enrollment for themselves. So we're doing just the opposite. IOIx Software is not enrolling any clients. In fact, we're separating ourselves off and completely selling off the agency Insurers of Idaho that started all of this. So our sole purpose is just simply to provide a service to service for brokers. So all of these 30 different companies that are providing web broker services as of today, and this is still true, we are the only company in the country that has a live web broker connection facilitating online enrollment as an alternative to sending your clients directly to healthcare.gov. So I think that's significant. For those of you that have been around the software for the last couple of months, you know that it hasn't been a smooth ride in all instances like we've hoped. We've had a lot of bumps and a lot of hiccups along the way. And a lot of that is just realize that we are in uncharted waters. We are doing something that no one has ever done before. We are doing it in a very complex way because we're using a single web broker connection, ours, and then we're facilitating enrollment on each of your websites. And we're doing that in a way that it brands your website all the way through the entire process, from quoting, application, enrollment, all of that has the look and feel of your website. So that in of itself is complicated, but the fact that we're kind of leading and paving the way with CMS for the web broker connection also has its challenges. So there's a number of issues that kind of come up from time to time. Some of them are on our end, frankly, and some of them are on CMS's end in problems with the connection to healthcare.gov. But as it stands today, since we sent the email out on January 9th telling each of you that the service was live, it's working really, really smoothly, I feel. There still are some issues that come up from time to time, but most are getting farther and farther and fewer in between. And again, some of the issues are on healthcare.gov and some of them are still on our end. But what I really love about the web development team that I have in place is that when issues come up, they get on it and they fix it. Our support team, which is available basically at this point 6 days a week and most hours of the day, when we find out about issues, we jump on them and we get them fixed. So we are very committed. We want each of you to be absolutely delighted with this service. To date, we have real close to 200 applications that have gone through end-to-end from starting on a broker website with the quoting, going over to healthcare.gov for the subsidy application, back to the broker website, and the enrollment is completed on the broker website. So the fact that we've got about 200 of these done, I think, is very significant, and it shows that the process is working. Also keep in mind, too, that the current web broker process with CMS is not an end-all, be-all. If you just use healthcare.gov directly, I count about 9 steps that are involved in the enrollment process. Using the web broker portal, there's about 11 steps. I really believe it's worth the 2 extra steps because long-term, the tools and the capability that this gives you as far as managing your clients, and I'll talk more about that in a minute. But really, the extra steps are involved around what we call the double redirect, where we have to send the clients over to healthcare.gov to complete the subsidy application, and the clients come back from healthcare.gov to complete the enrollment. Nobody likes a double redirect. We don't like it. We wish that the entire subsidy application could happen on our web broker portal. CMS is actually working on a potential solution through a product that they call Easy App, and I'm actually on a web call with CMS today and tomorrow and again next week as we try to work with them and help develop out some aspects to allow the subsidy application to happen on your website. So that's something potentially coming down the road. It's not set in stone. Also on our web broker connection, as it's live today, we don't have the payment option live for exchange-based applications. I'll show you in a minute. We do have it live for most of the non-exchange plans, but not the exchange ones. We are diligently working with carriers. So not only is this process new for us and new for CMS and new for you, but it's new for the carriers as well. Carriers are scrambling with enrollment, and at the same time, we're reaching out to carriers and saying, hey, we're the only live working web broker in the country. We want to facilitate a better, truly electronic interface with you. In fact, we want to send a copy of the enrollment file to the carriers at the same time we send it to healthcare.gov. But we have to have what's called an API to get kind of techie for a minute, a secure connection with them to send that information back and forth. Another thing that our web broker portal allows us to do is we can, on a continual basis, interface with healthcare.gov. So as your clients, through time, need to make changes to their plan, add dependents, drop dependents, change methods of payments, all of that will be able to be done if your client simply click on the My Account link that should be on the top of each one of your website pages. So if clients click this and log into their account is not just for the initial application, but it's the management of their policy long term. And then that will interface directly with healthcare.gov as far as making any changes on their policy. So keep all of that in mind. We still feel that the web broker portal that is live and working is underutilized. A lot of you have kind of gotten in the habit of interfacing directly with healthcare.gov, but I'm kind of here to show you today that this process does work, and I really feel that it offers some very distinct advantages for you. So let's kind of, without further ado, I'm going to use a demo website. This is kind of a template that we use when we're setting up new software users, and it works with all Utah and Idaho zip codes. So I'm just going to, I'm in Idaho, so I'll probably put in an Idaho zip code, and I'm just going to kind of walk through the process again where I'm really wanting to show off the whole system from quoting, and I'm not going to spend very much time on the quoting piece, to the application process, which is different for both exchange and non-exchange, and then how that enrollment file completes, and then how it actually interacts with Connected Agent and builds both the client and the policy record in Connected Agent automatically. Okay, so let's get started, and I'll just put in a random zip code, say no to the tobacco question, and click Instant Quotes. And of course, it becomes just that. So I actually am going to go through the subsidy calculator. We're still getting a lot of questions from brokers saying, hey, the amount of the subsidy is different on healthcare.gov than it was on my website. Well, there's a reason for that. disclaimer that we have here states exactly what this subsidy calculator is. It's an estimator. It's simply a tool that's designed with a few very basic questions to give your clients a reasonable expectation of what they can expect in regards to a subsidy. This is not the actual subsidy application. As we're all very much aware, the actual subsidy application is much more extensive. Not only that, when it takes place on healthcare.gov, they have access to a whole lot more information, including IRS records and an IRS interface. So we have seen an awful lot of times where the subsidy calculator is spot on to the penny, but there are times, depending upon the additional information that they put in when they're on the healthcare.gov website, where the subsidy calculator is going to be off. And sometimes it'll be off positively and sometimes it'll be off negatively, but it is simply just an estimation tool. So just keep that in mind when you use it. The logic behind the subsidy calculator is solid. We have tested it again and again and again, and the logic has stood up. We built the subsidy calculator with information that we pulled directly from the healthcare law itself. We went and dived into the law when we built that subsidy calculator. We have, and I'll just go ahead and kind of give you guys a spoiler alert, we have some changes that are coming to our quote engine fairly quickly. One of the things that we're going to do is we're actually going to separate the exchange and the non-exchange into different tabs. So we'll kind of tab it up top, and one tab will be the exchange plans and another tab will be the non-exchange plans. That way, when they click Buy Now, if they click it from the Exchange tab, it goes automatically to healthcare.gov. If they're on the non-exchange tab and they click Buy Now, then it's going to go directly to the insurance carrier. So stay tuned. We'll probably do an email blast on that whenever we make that upgrade. But there just seems to be some confusion when people are clicking the Buy Now, whether it's an exchange or a non-exchange. If you enter into those situations, as long as the plan's available both exchange and non-exchange, when you click Buy Now from the screen, unless you've gone in here and filtered just non-exchange, for example, it's going to send it directly to healthcare.gov. You do have the option, if you go to the More Info on any one of the plans and click Buy Now from that screen, it will simply ask if it's in an exchange or a non-exchange plan. When you're on the quote screen, and I'm actually going to change my income to demonstrate this a little bit. So instead of seeing monthly premium, if I qualify for a subsidy, I see subsidized monthly premium. There's some ways that tools that we've given you to help you determine whether or not your clients are looking at exchange or non-exchange plans. So if I go into filters and I say I want to show both exchange and non-exchange plans side by side, click filter. I can always tell which plan I'm looking at in two different ways. So if it says subsidized monthly premium, I know automatically that I'm looking at an exchange plan. Exchange plans are the only ones that qualify for subsidy. So down here at the very bottom, another subsidized plan. But this one right here just says monthly premium. Monthly premium indicates that it's a non-exchange plan in this situation because otherwise it would say subsidized premium. The other way you can tell is this legend. We've added some new icons. So we've added icons that indicate the metal level of the specific plans that you're looking at. And then we've also added icons that indicate whether they're an exchange or a non-exchange plan. So this icon, the one in blue, is the exchange plan, and then the one kind of in light green with a cross in the middle is a non-exchange plan. So we're trying as best we can to add tools and filters that will make this more client-friendly. We welcome any feedback that you as agents have. Again, this tool is for you. We want you to be extremely happy with the software, so we welcome any and all ideas. But the addition of these two icons, we think has been helpful. We still have some work to do with the cost-sharing subsidy when it's available. We recognize that, and we're working on that. So in this particular situation, if I qualify on the silver plans, and let me filter out the bronze here so it's easier to see. So now when I look at a silver plan, what was normally a higher deductible is now a lower deductible because of the of the cost-sharing subsidy, and I can see that, for example, here, Health Saver was $2,000, now it's a $1,200 deductible. So the cost-sharing subsidy is in there. If I pull up, for example, the SBC document for this specific plan, so I click More Info, and then click the Summary of Benefit and Coverage, it is actually going to be the SBC document for the cost-sharing plan. It's all built in here. We just need to do some things to make that process a little bit more visible to the clients. Okay, so that's really all the time that I wanted to spend on the quote engine today. I'm going to go ahead and I'm going to just dive into the online application. I'm going to show you the non-exchange one first, so I'm going to do it from this screen. So when I click Buy Now, I'm going to say I'm going to apply IOIx. And we'll do it as a new applicant with an effective date of March 1st. By the way, we did have, for example, April and May 1st effective dates on here at one time. We had to pull them off because when our interface with healthcare.gov for the exchange enrollment, they're only accepting files for current month enrollment. And I don't know why. We're going to ask them about that on our webinar this afternoon. But if you tried it on healthcare.gov, try to get an April 1st effective date, it would actually kick it out. And so we were having applications error out because of that, so we rolled it back to where it just shows the current month. After the 15th of the month, and then it'll roll forward and show the following month. Okay, so new application, non-exchange, March 1st effective date. I'm going to indicate John Doe as my agent. And just going to kind of make something up here. Actually, I'm going to do something different. I have a bunch of president names in here, so I'm going to kind of keep it in that format. Let's say James is single. Yes, he is a resident of the state of Idaho, has been for a while. Doesn't use tobacco. And I'll put in my email address here. So this screen does have to be completely filled out. This is part of the challenge with exchange applications, is that we're asking for a registration here and then also a registration when they go to healthcare.gov. But keep in mind, this is for your benefit. This is what gives you something to sink your teeth into, because the second this button is pressed, and I guess I'm short a number here, the system automatically has generated 2 emails. So it's generated an email to the client indicating, hey, you've started an application, and then it's also generated an email to you as the agent letting you know that your client has started an application. So if I go log in to Connected Agent for this particular database, instantly under Open Applications, I already see James Polk as a started off-exchange application. And I see, for example, if I'm the agent John Doe, I see all my agent information. So, I mean, instantly, all of this information that I just put in on the registration page automatically comes over to Agency Central. And we're going to see that continue as we go through the application. So typical off-exchange app, I'm not going to add any dependents. No, I don't have workman's comp. And I'm not going to add any prior coverage. And keep in mind, I'm doing this on a test database, so when I actually submit this, which I will in a minute, it is not going to send it to the insurance carrier. So if you try to test this on your own site, when you test it, it will, if you press submit, it will send it to the insurance carrier. So let's say, for example, I'm in eastern Idaho, and just make something up here. Another tool that we want to add here for primary care physician ID is we want to kind of do it as a drop-down box. So where when they chose a physician, then, but anyways, there's a lot of data that would need to be, but we're trying to do some things that will kind of simplify this process. And so I'm going to say no on the dental. And then I can specify that I want to have my first month's payment taken from my accounts. I'm going to do it as a monthly automatic withdrawal, but for now I'll just say, we're just going to say monthly billing statement. It'll be quicker, but clients can absolutely fill this information in, and it is sent to the carriers. Save and continue. That's really it. I've completed all of the steps for my application. Here's all the fine print, and simply go down here, enter in the 23rd, save and submit. And then you get this notification here, application number 9 successfully sent to carrier. And again, test database, so that's not real. And this is what your clients see from that screen. When your clients get to this screen, another email has been generated. You get a copy and your client gets a copy. So 2 more emails have been generated indicating that your client has successfully completed the enrollment application. Now let's go back to Agency Central. And if I click, for example, Open Applications, and let me refresh this here. Notice James Polk is not there because Open Applications are showing really people that are in a started phase. If you saw it here as a closed application, it would probably indicate that there was an error or there was a problem. But really what I'm looking, or actually it wouldn't say closed, it would say complete or finished. So really, the only thing that we should see anymore is started and closed. Completed usually means that there's an error in sending it to the carrier or sending it to the FFM. So if I now go to recently closed applications, it's actually going to come up as another tab down here. So I can toggle back and forth between open and recently closed applications. But it's going to show all applications for the last 30 days that have come through the system. So James Polk is in a closed status because he's enrolled. His application is not pending anymore. He's actually enrolled in a plan. So kind of to give you an example of this, if I go under Dwight Eisenhower here, I have the opportunity to mark it as a dead lead, which will close out that pending or that started application and take it off of my kind of review list, because the idea of open applications means, hey, I need to follow up with these people. Why did they start an application but they have not finished it? So closed means it's been finished either by you marking it as dead or the client has completed the application process. So now if I go into James Polk, I see all of the basic information. I can see, for example, and it's going to say fatal error on this one because we didn't actually send it to Blue Cross, but I would be able to pull this up as a PDF file and actually view the application that we sent to Blue Cross. And then if I click, give me just a second here. Seems to froze up on me. My email tab's not working here. So sometimes these demo databases are a little bit touchy because we haven't always updated them. But so now, knowing that James Polk is now closed, I can know that I can see him from both my client and my policy screen. So if I go to the client screen, here's James Polk showing as a current client. So current client, if you look at the different statuses, simply means that they have a policy in force. So I can now go and view the James Polk client record. I see some of these same tabs. Didn't have any dependents. I can see the link to his application, and I can actually pull this up and view it. So I can see the plan that he chose, the deductible, the coinsurance, and on your website it should be populating in the premium. Any dependent information, if you put it in, I can see that, and I can see where he actually signed it. I can go to the logs tab on your website. The logs tab would actually show the transaction history of this client, of it being sent to the carrier. And in addition to the application, I can actually see the policy that has been placed in force. So we have an in-force policy, individual medical for James Polk with the agent John Doe. And then I can click View and actually look at this policy record in detail. Now, the one thing that I don't have yet is I don't have the policy number. So if I am using this system to pay commissions and using it for commission tracking, at some point I'm going to need to come back in and enter in that policy number. I have the ability when I'm logged in as an administrator to edit the policy and make any updates or changes anytime that I needed to. Documents, here is actually another way of viewing the application on the Document tab. So I can actually, let's just say, download the Blue Cross file. And this actually then gives you a copy of the enrollment file that was sent to Blue Cross. So you'll be able to see everything here. You see the Idaho Individual Universal application, and in front of that you see the Blue Cross cover sheet all filled out. So all of this information is here, including the Certificate of Digital Security for the online application, any bank information. So you have a copy of the complete complete enrollment file that you can view and save as a PDF document anytime you want to. There's 2 emails that I refer to, all of it right here. So let's see which one this is. Oops. So this is just a thank you. Here's the off exchange application complete. James Polk, thank you for using John Doe. Your complete enrollment has, and this is the email that the client gets when it's actually been sent to the carrier. It's been sent to Blue Cross of Idaho. Blue Cross will be reaching out to you to facilitate the first month's premium payment. Now, I'm saying that, of course, because we didn't take any payment at the time of application. But so you can see all of this just from your clients completing an application through your portal. Notes, of course, is you have all of these normal functions of a client record, but what I'm simply trying to point out here is that just by your client completing that application, it has actually built the client record into the agency management system. And then if you do use it to pay commissions, if you do the commission tracking in here, then you can run reports on things like missing commissions to make sure carriers are paying you properly on all of these new policies that are being written. Okay, so let's go back to the website, and I'm going to actually go back through the quote engine and this time choose in an exchange plan and kind of show you how that process works and some of the hang-ups that agents have from time to time with the on-exchange application and clients as well. So at this point I won't say that I qualify for a subsidy, but I'm just going to click Buy Now from this page, which I know is going to take me through the exchange process. I'm going to say New Application. We'll make John Doe as the agent, March 1st effective date, and start your application. Now I come back to the same registration page that we were on before. Can't remember which presidents I have and which ones I don't have. So. Okay, so real similar screen. There's a few differences. We're not asking for Social Security number and length of Idaho residency. We actually will get the Social Security number, but we'll get it from healthcare.gov, so we don't need to ask it on this screen. Try to keep that screen just as simple as we possibly can. So now this screen pops up and says, okay, what are the steps involved for enrollment? And we've kind of outlined the 9 steps and trying to highlight here's where you're at, you know, Mr. or Miss Client. So you've got to go to healthcare.gov. So steps 3 through 8 involve leaving this website. These steps are completed on healthcare.gov. Once you have your subsidy results, be sure to click the Return to Issuer link to complete the remaining enrollment steps back on this website. And you really want your clients to do this for a number of different reasons. First off, the obvious ones that we've just talked about, where it creates a policy record here. It also then gives your clients the ability to go into the My Account link at a future date and make changes to their policy. And then it allows you to kind of know exactly where your clients are. You get emails saying, hey, this client's successfully enrolled. If they do this on the healthcare.gov website, instead of clicking the Return to Issuer link, all of these options are, you know, all of these benefits are lost. So when you go to healthcare.gov, a new window will open that provides tips and information to complete steps 3 through 7 while you're away from this site. A copy of the tips and information will also be emailed to you. So I'm going to go ahead and click on that. I think probably many of you have seen this. So it says, in number 1, by the way, it'll automatically put in your broker information right up top. But step number 1, create an account on healthcare.gov and click the Create Account link. So the most confusing part of this whole entire process is the fact that we are now asking the clients to create a separate account than the one that they've just completed on your website. This is the part that's frustrating for us, frustrating for you as brokers, and kind of a headache for your clients. So they've created an account on your website. Now they've got to go create another one, and that's just what it is for the current process. And then they're going to have to click on the link. So they have to open up their email and then click on the link and verify. They're basically verifying through email that, yes, this is a valid email address, and I have this link. But they have to open up that link, must log into your newly created account through that email link. Then they do the identity verification. These are all the normal steps, and then they do the subsidy application. And here's the part where it gets a little bit confusing, because even though they've come through the web broker portal, and they do not need to enter in your broker information here. They're going to come back to your website and complete enrollment, and the file that we send to healthcare.gov is going to have all of this enrollment information in it. So they don't have to put this information when they're on healthcare.gov applying for subsidy. It really doesn't matter, but it's asking them for it. And since it's asking them for it, and rather than explain to your clients that, hey, you don't have to put in this information, we just give it to them and let them put that information in. If they don't put it in and if they leave it blank, so long as they return to the issuer website and complete the enrollment through your website, you will get proper credit for the sale. So after they view the subsidy results and they scroll to the bottom of the page and click the Return to Issuer website, and in fact, it'll link your website right here, and then we give them some other tips and information. So a couple of things. The second they click Go to healthcare.gov, notice those tips and instructions, follow them, and the idea is that they have all of this broker information right there with them when they're on healthcare.gov. And now they're at the famous screen where you've either got to log in or create an account. And at this point, we're assuming that they're going to create an account. Notice, since they've come through the web broker portal, it says Return to Issuer website. That will pretty much, other than the identity verification, follow them all the time when they're on healthcare.gov. So the problem is I can't create an account. I can't trick the system, but I can show you guys a video of an actual application that went through where we just kind of blocked out the sensitive information. And I'm not going to show you all of this video, but I just kind of want to point out some different aspects of the web broker connection on healthcare.gov. This is the screen I'm sure all of you have seen before, where it's the creation of the account, and then the whole username and password thing. I'm going to fast forward a little bit. Confirm the password, and they're going to answer those silly questions. and then we send an email to, and they have to click that email link. And then once they click the email link, they get this marketplace account created, and the account's been created, continued. You've now logged back, and now you got to log back into your account. Then after that becomes the identity verification, and then the actual subsidy application. No, well, I guess never mind. Well, now we're just getting to the verify identity. But notice how it says return to issuer website. That's going to kind of follow them all the way through the process. I think this video just cuts through. We're not going to actually have. I'm just going to kind of fast forward to the end of the subsidy application. They're signing and submitting their actual subsidy application. Now they get to the screen where eligibility results. And at the bottom of that page, it says where it says go to issuer website. So really, the options are you can view your eligibility results, which we'll just pull up here and view. But the only other option on that page is to go to the issuer website. So long as they don't break the connection somehow, and usually if a client breaks the connection, it's not their fault, the only option at the bottom of that page is the return to issuer website. And once your clients do return to the issuer website, here's what your clients is going to see. Plan selection and enrollment details. Persons enrolling in coverage, it will have the client's name and it will list every family member. It will show the advanced premium tax credit amount that is available for every family member. It shows them the plan that they chose, the premium of the plan, all of those details. It gives your client the option of changing the plan or viewing additional details about the plan. Now, if they do click this, it is going to take them back through the quote engine. And then if they go back through the quote engine, really the only option that they have is, and let's pull out of this here. Is when they log into their account, and they can edit, continue their application. So they'll go through the quote engine, they'll come back to this screen, edit, continue their application, and it will actually take them right back here. But we have to give people, of course, the option that, particularly if their subsidy is different, if they want to change their plan selection. Clients actually do not have to take the full advanced premium tax credit amount. So if I qualify for a $77 tax credit, I could decide to put in $50 a month if I wanted to. I don't have to take the full amount. Once you click Save and Continue, then it takes you to the next page in the process. And we revamped this screen, by the way. That's why I'm not showing the one off of the video. But anyways, it takes you to this screen now where clients have the ability to, they can kind of see that they've completed all of the steps. This should look real familiar to, it's just like the off-exchange application. And then they simply sign and enter in their name. And then this is what you're looking for. You want your clients to see, sorry, having a hard time getting it to the right spot here. You want your clients to see this screen where it says, thank you for completing your application. Your agent, whatever the agent's name is, will be in contact with you shortly. So as long as your clients see that screen, then we know we have a successful exchange enrollment. The other problem that we sometimes have is when clients click the Go to Issuer website, if it comes up with some type of error message or says page cannot be displayed, then we need to know about that. We have not run across any problems that we cannot fix as long as we know about them. So, I called an agent up just randomly yesterday and said, hey, how's the connection going? Well, it didn't work, and so I'm just sending my clients directly to healthcare.gov. Well, did you let us know it didn't work? Well, no. If it doesn't work, let us know. Again, Mike got tech support twiddling their thumbs because we don't have any issues that they're working on right now because we don't have anybody reporting problems. So if you are finding problems with any portion of this link not working, let us know. We'll get it fixed. We're getting these type of errors fixed very quickly. But from all intents and purposes of what we can see, the connection is working properly. If you find times and instances where it doesn't work like I've showed you today, please let us know. Okay, I've got a number of questions that I want to answer. One question that one of you asked early on that I did want to get in and show in the quote engine real quick. So the question is, how can we actually, just a couple questions there. Okay. All right. Is there any way you can have a print now button on the comparison page? That is probably the single most requested feature addition we have, and so we will add that feature very, very soon. But what Terry is talking about is that when you're on this page right here where you're comparing plans, you have the option, of course, to buy now, view the SBCs, the return to quote screen, but you don't have any type of print option. So we will add that. Until we add that, I want to point out that you have the ability to just do something like this. You can actually just copy as much of this page as you want, and then I'm just going to show you in like a Word doc here. Probably the easiest thing to do. And this works with email too. You can paste this in email, or you can paste it in a Word doc. But it works actually kind of better in email. I mean, I guess if I change my page layout here, yeah, it works better in landscape mode. But I mean, so this looks pretty good. It looks just like kind of what you're seeing on the website. But what's significant is that these links work. So this link works from an email, from a Word document, and it will actually pull up this information. So if I actually, for example, click the Buy Now button, if you copy and paste it right, I mean, if you copy and paste the full thing, you're copying and pasting these links as well, right from the Word doc. So I'm just going to give you an example of that. Boom, it'll actually pull up and take me right to the page in my web browser. So that's just kind of a workaround until we do actually add. We're going to add two things, not only a print capability, but where you can actually save the quote and email the quote as well. So we've kind of got some neat ideas for some additional functionality on that. Okay, so I'm going to go ahead and clear a couple of these questions out here. So we have a broker that's asked this question. I sent an application to Select Health through your system. They denied receiving them. Has this been fixed? Yes and no. Select Health probably does have your application. The problem is Select Health is absolutely overwhelmed for two reasons. I think they're getting a higher exchange enrollment than they ever anticipated getting. But also, in Idaho anyways, for example, better than 50% of all of their non-exchange applications are coming through our system. And right now the process we have with Select Health and with the other carriers is that we're simply emailing them a PDF file. And we send it all via secure mail, but we're emailing them a PDF file of the exchange application or the non-exchange application. So when we email that to them, at one point in time we had heard that it was taking them a week just to simply open up the email, and then another 3 to 4 weeks to process it. So Select Health actually reached out to us about 2 weeks ago and said, and this was a continuation of a conversation we'd started with them over a year ago, hey, can we set up a truly electronic interface with you where these applications can feed directly into our system, because processing them by hand is just taking us forever. And we said, absolutely. We have another call, I think, with them on Tuesday where we're going to sit down and we're working on this. And hopefully that will kind of alleviate the problem. So again, Select Health very likely has your application, but they just may be so buried in their stack of applications that they haven't been able to find it. So one thing that you can always do is, for example, and I don't think it's going to work in my demo database here, but if you go to the Logs tab, yeah, it's not working in the demo database. what you're looking for is you will see confirmation that the application has been sent to the carriers. And if you see anything in red, the red always indicates that there's an error. I think it may work in this. Yeah, here's another demo database that I have, and let's see if I can show you the logs in one of these. These are a little bit older, but yeah, that's not working either. So, but anyways, so if you see any red when you view the logs, if there's anything in red or anything that says error, please contact our tech support immediately. But what you'll normally see is that it would say it was successfully sent to Select Health and would show you the date and time that the application was emailed to Select Health. And so you could actually pull that up with them on the phone call and say, hey, I've got a log right here that shows that that application was emailed to you through the IOIx software portal on such and such date and time. If you run into issues with Select Health and you're not getting anywhere, let us know. I mean, we have the ability to kind of escalate that if we need to get involved for you. So here's a great question. How can we add clients in the connected agent who did not go through my website but went directly to healthcare.gov? That's real easy. You go to your client screen, and as long as you're logged into Agency Central, you can't do this from Connected Agent, but if you're logged into Agency Central, then you have a little button here that says New Client. For example, if it's individual, you would specify that, put in as much of this information as you have. And I'm just doing this demo database here, so. Because the next step is pretty important too, and most of this information is not required because you may or may not have it. But once you've created a client record, now keep in mind somebody's a client because they have a policy in force. So after you've created the client record, then you'll actually want to come in here and create the policy record as well. So you would specify the agent, specify the provider, and then the type of policy, whether it's individual medical, group medical, accident, dental, vision, whatever it is. And then you would pick, for example, the corresponding plan if you knew which plan it was. If you didn't know what plan it was, you could even specify that it's unknown. If you have the policy number, great. If not, it's not a required field. Anyways, you go through those steps and you actually create the policy record for the client as well. If you have additional questions on that, feel free to reach out to tech support. They've got some documentation, or they can even help you with that on the phone. So the question's being asked, can they use the same username and password that they use when they go on our website that they use when they go to healthcare.gov? And the answer to that is absolutely. We used to have slightly less stringent password requirements on our website than they did on healthcare.gov, and we actually changed the password requirements to match what healthcare.gov is doing, so that so long as their username and password that they use when they created your account on your website is available, they can use that on healthcare.gov as well. And then the next question is does the cost sharing info display on the enrollment screen? And the answer is, as of today, yes. So one thing we didn't, and it's my fault, we did not do a real good job of communicating, is that when this first came out on January 9th, it was not factoring in the cost sharing information. In fact, we didn't know that for a day or two, but it is as of today on all of our websites. We kind of tested it a little bit internally first, but all of the cost sharing information will appear on this screen. By the way, when your clients actually get to the point where they've submitted this and they have this screen, when you go into, so when you're on your task panel here, for example, and if I go to my recently closed applications, and I pull up somebody, let's say, for example, James Polk, and again, this is the problem here is this is an off-exchange one, but if I pull up the documents for the exchange one, then I will actually, basically what I'm going to end up seeing is a copy of this screen. All of that information that is here will appear in Agency Central as well. Okay, just give me a second here, folks. I'm reading through some of these questions. By the way, this really is the conclusion. I've kind of demonstrated everything I wanted to demonstrate today. So I'll just spend the remainder of the time answering questions. If any of you need to drop off, that's fine. So if they lose the link to return to a subscriber, how can we get the connection back? So what I think you're asking is when they're on the healthcare.gov website, the Go to Issuer website, there are some instances where that disappears. The best advice that I can give you when that happens is I would direct your clients to come back to your website, click on the My Account link, and then click the Edit Continue of their application. And then, they'll kind of go through this process again. They'll go right through the registration screen. They can just click Save and Continue. But then when they go back to healthcare.gov, and then when it pops up to this screen, they should be able to just log into their account with the username and password that they have set up. And once they do that, if that return to issuer website is not there when they log into their account, please let us know, and then we'll probably have to let CMS know and say, hey, there's a problem on this application with the return to issuer website not being there. But great question. So. And then kind of a repeat, are you working on the user and password to match the feds? So again, the requirements on our portal, I believe, are exactly the same as they are on the federal portal. But the problem is when they're on your website and they're creating a username and a password, they're doing that first on your website. So if for some reason that username and password is not available when they get to healthcare.gov, then they would have to choose a new username and password. So the question is the return to issuer website link only seen if they're going through the IOIx web broker portal, or will it work directly if they go to healthcare.gov directly? So if somebody just comes to healthcare.gov directly, then of course they're not going to see this. But so long as the account, when they created this account, so long as they were linked to the issuer website when they created the account, even if they go to healthcare.gov and log back in, the return to issuer website should be there. Now I say should be there because I've seen instances where it's not. For that reason, that's why we're always suggesting that your clients go through My Account on your website to get back to healthcare.gov, because much more consistently than the return to issuer website link seems to be there. And another question about the cost sharing subsidy. When will the cost sharing subsidy be accurate when returning from healthcare.gov? And again, that should be accurate today. We partially pushed it out a couple of days ago to some of the websites, and we pushed it out to all of the websites today. So Carl, check it again. If it's not working, then please let us know. So question is on the application screen, when viewing an application in the admin section, what happens to the app after 30 days? So recently closed applications only shows recently closed applications for the last 30 days. So pretend with me for a second we did not have this button here, because we've actually really recently added that. So if it's not open, the only other place you can see it in two other places. You can see it in your client record screen, and you can see it in your policy record screen. The reason we added recently closed applications is because, you know, if you're just sending out the link to your client, say, hey, come to my website and enroll in a healthcare.gov plan, you don't know which clients have done that. So going through here and seeing, for example, all of a sudden you have a new policy for John Adams that wasn't there a week ago, that would be impossible to track. So by showing you and giving you a tool to see all of the activity for the last 30 days, you know, you can say, okay, these are all the open applications. These are the people I need to follow up with. And these are the people over the last 30 days that have actually completed the application. So after 30 days, you just view them in your clients or your policy tabs. And by the way, too, this recently closed applications is only going to show on your task screen when you have recently closed applications. So if you don't have any applications that have been closed in the last 30 days, then you won't even see this tab. if the second one becomes closed, then that number will increment to reflect that. Okay. Sorry, give me just a second here, folks. So you got a report from one of you saying that when someone put in a username and password in my website, it would not accept the username without it putting in a number. So I tell everybody just include a number. So let me double check. I've been under the impression that our username and password requirements match what the federal requirements are, but if that is not the case, then we will make the change so that that is the case. And then on the exchange application, when will the dental option be available when returning to the IOIx portal? I think we're very close on that. We've been working on getting that dental piece fully integrated, so it's going to be sometime next week. My guess would be towards the middle of next week. We'll of course send out an email once that's fully functional and live. So. And then another one of you saying that the feds require a number and the username. So apparently we don't quite have a match. So I'll get on that. So brilliant question from one of you: is pediatric dental actually required? And technically the answer is no, it is not. Since Idaho apparently did not expand Medicaid, technically speaking, you are not required to purchase pediatric dental in Idaho. But the carriers will admit that, I guess, if you push it with them. But they're certainly not going to broadcast that information out in any type of setting. So. Rachel, on your question, if you could just kind of reach out to me directly, and I'll just kind of talk to you about that directly. So. All right, and then I get another one of you telling me that the feds do not require a number in the username, only in the password. Any other thoughts on that subject? Okay. All right, unless we have any other questions, that really is it. I've